Hi everybody and welcome back to my vlog. Still don't know what that stands for, video log. Today we're going to talk about a slightly different topic. It's not really news related or pop culture related. It has a little bit more to do with patient safety. So patient safety is always something that I'm a pretty strong advocate of, and a lot of the topics of my videos are going to be based on ethics and patient safety. So one thing that I'm a stickler about is the idea of board certification. Everybody now somehow is a board certified plastic surgeon. I see it everywhere. I'm a board certified plastic surgeon. I found out that you could be a board certified pediatrician who does plastic surgery, and then therefore you're a board certified plastic surgeon. So it's really important to sort of get your facts straight and really ask more specific questions. What kind of board certification? So on and so forth. So I'm sort of trying to figure out how I can convey this message. And when I Googled questions to ask your plastic surgeon, a pretty interesting article popped up on plasticsurgery.org, and the title, very creatively, is questions to ask your plastic surgeon. So that I don't want to be staring at my phone and reading them the entire time. So I will assign this task to my associate. So if she wants to ask questions, I will repeat. So why don't you go ahead with the first one?
Are you certified by the American Board of Plastic Surgery?
Are you certified by the American Board of Plastic Surgery? So there's only one American Board of Plastic Surgery. That's the only plastic surgery board that is accredited by the American Board of Medical Subspecialties. The answer is yes, I am accredited. So you got to ask if your plastic surgeon is board certified in plastic surgery by the American Board of Plastic Surgery. Next question.
Are you a member of the American Society of Plastic Surgeons?
Are you a member of the American Society of Plastic Surgeons? So to be a member of the ASPS, which stands for the American Society of Plastic Surgeons, you have to be board certified and you have to be invited by other plastic surgeons and approved for membership. So it's sort of one more feather in your cap. I happen to be also part of the American Society of Plastic Surgeons.
Were you trained specifically in the field of plastic surgery?
Were you trained specifically in the field of plastic surgery? So a lot of people, for example, and this is not to knock them at all, like dermatologists and things like that, call themselves plastic surgeons or facial plastic surgeons. It's really important to ask, were you specifically trained in plastic surgery, or is this something maybe that you picked up after the fact because you found out it was easy and you're pretty good at doing eyes? It's a really good question. Make sure your board certified plastic surgeon is specifically trained in plastic surgery. To be a board certified plastic surgeon, you do have to specifically be trained in plastic surgery.
How many years of plastic surgery training have you had?
How many years of plastic surgery training have you had? It's a really good question. So there's kind of two pathways. You can either do general surgery or head and neck surgery or some other kind of surgery, followed by a fellowship in plastic surgery, or more recently, and this is the pathway I followed, you can have an independent or an integrated or combined approach where the general surgery and the subspecialty training are sort of packaged into one. So for me, technically, I had 4 years of plastic surgery training, 2 years of general surgery training, 1 year of microsurgery training. So that would be 5 years of actual plastic surgery training. The minimum is 3. So if anybody has more than 3, you're probably pretty good to go.
Do you have hospital privileges to perform this procedure? If so, at which hospital?
Do you have hospital privileges to perform this procedure? This is probably in brackets, meaning whatever procedure you're discussing with your plastic surgeon. You got to make sure that your hospital has cleared you to do a certain procedure, because they're not always double checking. Say somebody wants me to do an ankle bone fracture, and I'm a plastic surgeon, but hey, I think I know how to do that. I could probably book a case for ankle fracture repair at my hospital and get away with it. That's like not very cool. So if you're a really savvy patient, you want to make sure that whatever center or hospital that your plastic surgeon's taking you to has credentialed you to do those certain operations. It just means another set of eyes has cleared you that say this guy is safe to go. What's the next question?
Is the office-based surgical facility accredited by a nationally or state-recognized accrediting agency, or is it state licensed or Medicare certified?
So basically, that's a really long question that asks, doctor, wherever you're taking me to do whatever you're doing, is this an accredited facility? I mean, honestly, That's a long question for a plastic surgeon, but during your preoperative consultation workup and preoperative meetings, you should probably find out where you're going, and you can do your homework on your own to make sure that you are being taken to a legitimate center that's either qualified by or accredited by the the Quad ASF, for example, my little operatory is, or if it's Medicare or J-code. There's a lot of different acronyms for credentialing agencies. But yeah, you want to have surgery by a legit surgeon at a legit place.
How many procedures of this type have you performed?
So regardless of what you're doing, what you've chosen, you've got to ask your plastic surgeon, and you've got to get a pretty convincing answer as to how many of that type of operation the surgeon performs. You can go kind of look at his or her gallery, or you can follow Instagram or things like that, or even by word of mouth, you can get a sense that this person is qualified and experienced in the procedure you're considering.
Am I a good candidate for this procedure?
That's between you and me to decide. Next question.
Where and how will you perform my procedure?
Where and how will you perform my procedure? I guess that's procedure specific. Next question.
How long of a recovery period can I expect, and what kind of help will I need during my recovery?
Fine. So the rest of the questions here are a little bit more procedure oriented, but the first series of questions that I presented to you today are definitely questions that should be asked, maybe up to is the OR credentialed, or is it an accredited facility? I think everything before that is going to be good enough to qualify your plastic surgeon as a safe provider for the procedure you're considering. There's just too many stories, you guys have heard them all, about people having botched plastic surgery or serious life-threatening complications when they're trying to cut corners or save costs by doing it elsewhere, either in different states or different countries, even worse. So take the time to make sure and pre-qualify your own plastic surgeon by asking some of the first questions that we presented today. And then as we sort of move on in the consultation process, you can gauge this plastic surgeon's ability to sort of mirror your own goals and desires and to be available to you post-operatively should any complications occur. So this is my patient safety announcement for the week. I hope you guys have a great week, and I can't wait to see you next week. Bye.